If you're over 60 and living in the US, this message is for you. After talking to many healthcare workers and listening to the real experiences of seniors, I've uncovered some tough truths about how older adults are treated in medical settings. It's not always intentional, but the system often works against you. Doctors are under pressure. Insurance companies push limits, and age becomes a shortcut that shapes decisions before you even speak. Have you ever felt rushed, brushed aside, or told, "That's just aging"? If so, you're not alone. But here's the important part. You don't have to accept this. Once you understand the patterns, you can change how every appointment goes. You can walk in prepared, ask the right questions, and leave knowing your concerns were taken seriously. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. Now let me give you the roadmap. First, we'll uncover the hidden label that doctors place on seniors, expensive and complicated, and how it affects the time and care you receive. Second, we'll talk about the financial pressures shaping medical decisions, why doctors often choose faster, cheaper solutions that may not be right for you. Third, we'll look at how symptoms are dismissed as normal aging, delaying real diagnosis and treatment. Fourth, we'll explore the troubling practice of prescribing medications to control behavior rather than treat actual problems. And finally, we'll face the painful truth about how some providers quietly question your cognitive abilities and make choices for you instead of with you. This isn't about fear. It's about power. And once you see these 5 realities clearly, you'll know exactly how to protect yourself and get the care you deserve. Doctors often label seniors as expensive and complicated before you open your mouth. The moment your age appears on the chart, many providers slip into mental shortcuts. Seniors need more tests, more meds, and more time. That label might not be spoken aloud, but it shapes how much attention you get, how many questions they ask, and even which treatments they recommend. It's not that doctors are cruel, most are just juggling impossible schedules and insurance rules. But the system has programmed them to see age as a burden, and sadly, you feel the result. Let me share a story. Richard, a 71-year-old retired postal worker, went to his primary care doctor with 3 concerns: constant fatigue, shortness of breath, and a nagging chest ache. He had taken the time to write down a clear list, hoping to make the visit efficient. But before he could finish explaining, the doctor interrupted. "Let's stick to one issue today, Richard." His chest pain was brushed aside as stress, and months later he landed in the ER with a serious heart condition. All because the doctor assumed an older patient with too many problems was too complicated to sort through in one visit. And Richard's story is not unusual. Studies show that doctors spend around 20% less time listening to people over 65 than to younger patients with the exact same symptoms. Why? Because older adults are automatically flagged as requiring extra work. This creates resentment, unspoken but real, that can reduce the quality of your care. The consequences are big. Instead of seeing you as a unique individual, doctors fall back on generic senior solutions. A quick prescription for blood pressure, maybe a sleep aid, or advice to exercise more. Meanwhile, underlying conditions can get missed or delayed. It's not that you're complicated, it's that the system doesn't allow time for complexity. So how do you turn this around? You shift the frame. Walk into your appointment with a clear, measurable health goal. Don't just say, "I'm tired." Say, "My energy has dropped by 40% since June and I want to find out why." That changes you from a difficult senior to a focused, goal-driven patient. Bring a one-page health summary with your medications, allergies, and main symptoms. Doctors love efficiency. Showing them you've done the work earns respect and attention. Another powerful move is note-taking. When you pull out a pen or open your phone to jot things down, the doctor immediately realizes you're paying attention and will remember the details. This subtle accountability often changes how seriously they respond. And finally, don't be afraid to ask for more time. You can say, "Doctor, I know we're short on time today. Can we schedule a longer visit next week to focus on my heart concerns?" That shows respect for their schedule while making it clear that your issues deserve thorough attention. You may not be able to erase that first mental label of complicated, but you can prove you're organized, proactive, and ready to partner in your care. That simple shift changes how doctors see you, and it changes the quality of care you receive. One of the most common tricks the healthcare system plays on older adults is what I call polite medical gaslighting. It sounds gentle, but it's actually harmful. You walk into an appointment with real concerns, fatigue, pain, dizziness, or changes in mood, and instead of investigating, the doctor waves it off with a smile. That's normal at your age. What should lead to proper testing gets brushed aside as just part of getting older. Take Eleanor, a 69-year-old grandmother from Ohio. For months, she complained about sharp joint pain that seemed to be getting worse. Each visit, her doctor told her, "Eleanor, you're just aging. It's wear and tear." No tests, no x-rays, nothing. Finally, after pushing for answers, she was diagnosed with rheumatoid arthritis. But by then, the delay meant permanent damage had already been done to her joints. What should have been treated early was ignored because her symptoms were dismissed as just normal aging. This is not a rare story. In fact, studies show that the majority of serious conditions in seniors are first blamed on age before a proper diagnosis is even considered. Heart problems get disguised as slowing down. Depression gets brushed off as adjusting to retirement. Even early cancer signs can be mislabeled as just wear and tear. The result? Dangerous delays, missed treatments, and sometimes outcomes that could have been prevented. The worst part is what this does to your confidence. After hearing, "It's just aging," again and again, many seniors start doubting themselves. You begin to think, maybe I am just overreacting. That self-doubt is dangerous because it keeps you from demanding answers, and it makes you more likely to accept substandard care. But here's the truth. You have more power than you realize. There are simple, respectful ways to challenge this gaslighting and get the attention you deserve. The first is to ask evidence-based questions. When a doctor says, "That's normal for your age," respond with, "What percentage of people my age have this exact symptom?" Or, "If I were 45 with the same complaint, what tests would you order?" These questions put the responsibility back on the provider to explain their decision. And most of the time, they can't justify it, because it's not medical science, it's age-based assumption. Another smart move is to create a symptom timeline. Instead of saying, "I've been more tired lately," write it down clearly. "My energy was steady until July 15th. Since then, I need a nap every afternoon, which never happened before." This shows a sudden change, not a gradual decline, and doctors are trained to respond to new changes. Finally, don't face it alone. Bring an advocate with you, a spouse, a sibling, or even an adult child. When a second person hears the dismissal, doctors often adjust their behavior immediately. That advocate can also remind you of questions, take notes, and back you up if you feel brushed aside. So remember this: "It's just aging" is not a diagnosis. It's a dismissal. You know your body better than anyone. When something changes suddenly or feels off, it deserves real investigation. By asking smart questions, tracking your symptoms, and bringing support when needed, you can break through the gaslighting and make sure your concerns are heard. Another silent barrier many older Americans face in healthcare is the assumption that you can't handle complex information. Doctors often believe that once you're past 65, you won't follow detailed treatment plans, understand medical terms, or manage advanced therapies. So instead of giving you the full picture, they simplify things, keep explanations short, and sometimes even leave out important options altogether. Let me share a story. Thomas, a 74-year-old retired high school principal from Michigan, was diagnosed with prostate cancer. His doctor quickly recommended a simple surgical option and brushed past other possibilities. When Thomas asked about different therapies, the doctor replied, "At your age, simpler is better." Only after seeking a second opinion did he learn about targeted radiation and new medications that were highly effective for men in his age group. He ended up choosing one of those options and is now doing well. If he hadn't questioned the first doctor, he would have been left with a limited, one-size-fits-all plan. This type of bias is more common than you think. Doctors sometimes slow their speech, avoid technical terms, or skip over complex treatments when talking to seniors, even those with decades of professional experience. They assume you won't remember the details, can't manage multiple medications, or won't use technology like health apps and patient portals. But those assumptions rob you of choice. They limit your access to modern treatments and leave you with watered-down care. Here's the truth. Age does not equal inability. Many older adults are more organized and disciplined with health than younger patients. You've managed businesses, raised families, run households, and navigated life challenges. Of course you can handle detailed medical information. So how do you challenge this politely but firmly? Start by signaling your capability right away. At the beginning of an appointment, say something like, "I've managed complex projects for years. I'd like the full details, please." That one line reframes the conversation. It tells your doctor, "Don't hold back." Next, ask technical questions on purpose. For example, "Can you explain what's happening inside my body and how each treatment works?" This forces the provider to treat you as an equal partner in decision-making. Bring a list of questions you've prepared in advance based on your own reading or advice from specialists. This shows you've done your homework and expect thorough answers. Another strategy is to use technology in the room. Open your patient portal, pull up your medication list, or check drug interactions on your phone. When doctors see that you're comfortable with digital tools, it challenges the stereotype that seniors can't keep up with modern care systems. And finally, request written treatment plans. Tell your doctor, "I'd like a detailed summary of all my options so I can review them at home." This ensures you don't miss information and shows you intend to make informed decisions. The bottom line is this: you are more capable than the system assumes. By speaking up, asking for details, and using tools that show your independence, you prove that you're not just able to handle complexity, you expect it. And that's how you secure the quality care you deserve. Now we need to talk about something very serious: how medications are sometimes prescribed not to treat your actual condition, but to make you easier to manage. It's uncomfortable to hear, but many older adults in the U.S. experience this every day. Doctors or care facilities may hand out sedatives, antidepressants, or sleep aids, not because you truly need them, but because these drugs keep you calmer, quieter, or less demanding. In other words, medication is sometimes used as a shortcut for behavior control instead of real medical treatment. Let me share an example. Janet, a 68-year-old retired accountant from Texas, was recovering after hip surgery. She was frustrated with her slow progress and kept asking her care team questions about timelines and exercises. Instead of explaining clearly, her doctor prescribed an anxiety medication to help her relax. The drug left her groggy and unsteady, and within weeks, she fell at home and broke her wrist. What was supposed to calm her down ended up extending her recovery by months. And Janet's story isn't unusual. Studies show that nearly half of seniors are prescribed psychiatric medications at some point, yet only a small percentage actually have a diagnosed mental health condition that requires them. The rest are often given pills for nerves or agitation or sleep issues that could be handled differently. The problem is, these drugs carry real risks: confusion, memory problems, dizziness, even increased risk of falls. Sometimes they create new problems that get misdiagnosed as separate conditions. A sedative can cause forgetfulness that looks like dementia. A sleep aid can disrupt your natural cycle and lead to real insomnia. This doesn't mean all medication is bad. Some prescriptions are absolutely life-saving and necessary. But the key is making sure each drug you take has a clear purpose, a measurable goal, and a plan for review. Here are a few simple ways to protect yourself. First, always ask, what specific condition is this medication treating? If your doctor can't give a direct answer, that's a red flag. Second, ask, how will we measure if it's working, and when will we review or stop it? Medications should never be open-ended, without checkpoints. Third, push for alternatives. Say, are there non-drug options we can try first, like therapy, lifestyle changes, or physical therapy? You'd be surprised how often there are safer, effective choices that don't get offered unless you ask. Another powerful step is to request a medication review. Pharmacists and geriatric specialists are trained to spot unnecessary drugs, dangerous combinations, and opportunities to reduce your prescription list. Many seniors discover they've been on pills for years without any clear reason. Finally, document how you feel before starting a new medication. Your memory, balance, mood, and energy. If things change after you start, you'll have evidence to show it's the drug, not just aging. And always involve a trusted family member or advocate. If side effects cloud your judgment, you'll have someone to step in and ask tough questions. The truth is, your voice matters. You deserve medications that heal, not drugs that silence you. By asking the right questions and insisting on reviews, you make sure your prescriptions serve your health, not the convenience of the system. The last and maybe the most painful truth is this. Behind closed doors, the healthcare system often calculates how much your life is worth before recommending treatments. It's not something anyone will say out loud, but it happens every day in hospitals and insurance offices across the U.S. When you're over 65, many providers look at your age, your expected years left, and the cost of treatment. And those numbers quietly influence the care you're offered. Let me give you an example. Frank, a 70-year-old retired engineer from California, was diagnosed with kidney failure. Instead of being presented with all the treatment options, he was steered straight toward palliative care. Dialysis was framed as too much for someone his age. But Frank wasn't weak. He was active, independent, and still hiking every week. After fighting for a second opinion, he finally got dialysis. The treatment restored his energy and gave him 7 more years of quality life. 7 years that would have been taken from him if he had just accepted the first recommendation. This is how the system works. Younger patients are seen as a better investment, so they get access to expensive imaging, aggressive treatments, and newer therapies. Seniors, on the other hand, are often told it's risky or it's not worth the side effects. But many times, that's not about medicine, it's about economics. Insurance companies, hospitals, and sometimes even families lean toward cheaper, less aggressive care for older adults, assuming it's more appropriate. The danger is that seniors start to internalize this message. After being told enough times that certain treatments aren't for your age, some older adults stop asking, stop pushing, and settle for less. That's not dignity. That's discrimination dressed up as medical logic. So how do you protect yourself? The first step is to ask the golden question. Would you recommend this same treatment if I were 45? If the answer is no, ask why. Make the doctor explain the medical reasons, not the economic ones. Second, come prepared with evidence. Research your condition and bring statistics showing how seniors your age respond to treatments. There are countless studies proving older adults benefit from therapies that are often denied. Third, always seek multiple opinions. A general practitioner might push for comfort care, while a geriatric specialist or another expert could recommend active treatment. And don't forget, you have the right to appeal insurance denials. Senior advocacy groups and legal aid organizations exist to help with this, and they know the system inside and out. Most importantly, never accept the idea that your years ahead are less valuable than anyone else's. Whether you're 65, 75, or 85, your life matters. You deserve equal access to testing, treatments, and therapies, not just the ones deemed cost-effective. The truth is, when you stand up for yourself, you're not only fighting for your own health, but you're also pushing the system to change for every senior who comes after you. Don't let anyone quietly discount your worth. Your years are yours, and they matter. Now you've seen the 5 hidden truths about how age bias shapes healthcare for older adults in America. Doctors may label you as complicated, dismiss your symptoms as just aging, assume you can't handle complex treatments, prescribe medications to keep you quiet instead of healthy, and even weigh your care against the value of your remaining years. None of these things define you, but if you don't recognize them, they can hold you back from getting the care you deserve. Here's the difference. Awareness gives you power. When you know these patterns exist, you can walk into every appointment ready to change the script. You can lead with clear goals, ask evidence-based questions, track your symptoms, demand full explanations, and insist on fair treatment. You can show that you're capable, organized, and committed to being an active partner in your own health. Think about the stories we shared. Richard pushing past rushed visits, Eleanor demanding tests that revealed her arthritis, Thomas asking for full options, Janet uncovering the risks of unnecessary medication, and Frank fighting for dialysis that gave him 7 more years of life. These are not rare exceptions. They're proof that when seniors speak up, real change happens. So let this be your reminder. You are not just getting older. You are valuable, capable, and worthy of the very best care available. Every time you advocate for yourself, you're not only protecting your own health, you're making the system better for every older adult who comes after you. Now it's your turn. Share your own story in the comments. Have you ever felt dismissed or talked down to in a medical appointment? What will you do differently next time? Let's build this community together because your voice matters and your life is worth fighting for.